Hello! I am Dr. Clint Walter Bacoy.
I am Dr. Lois Cabasal and we are graduate students in Orthodontics.
Today, we are presenting a video for retainers focusing on the most commonly used retentive clasp, namely
Adam's clasp, circumferential clasp, triangular clasp, and ball end clasp. There are three basic components in a retainer. A base plate, which can be made of self-cure or heat-cure acrylic, active components, if your retainer is an active retainer, retentive components, which includes the clasp. They aid in keeping the appliance in place and resist displacement of the appliance in the mouth. In this video, we will be briefly discussing the commonly used clasps and how to wire bend them.
clasps provide retention by engaging onto the undercuts of the teeth. There are two types of undercuts found in natural dentition. Number 1, buccal and lingual cervical undercuts. The buccal and lingual undercuts are much less extensive and are not accessible until the teeth are fully erupted. Number 2, mesial and distal proximal undercuts. These undercuts are found right below the contact points. They are accessible very soon after a tooth has erupted. Thus, a clasp that makes use of mesial and distal undercuts is most useful and more efficient than a clasp which makes use of buccal and lingual undercuts.
An ideal clasp must offer adequate retention, permit usage in both fully and partially erupted teeth, passive, easy to fabricate, does not impinge on the soft tissue, and does not interfere with normal occlusion.
The first clasp that we will be discussing is circumferential clasp. It is also known as three-quarter clasp or three-fourths clasp. They are very simple clasp and engage buccocervical undercut. The wire used is 028 stainless steel.
Advantages is that it is easy to construct and has a simple design, and it prevents mesial migration of the tooth. However, for the disadvantage, it can't be used in partially erupted teeth. In making a C-clasp, you simply have to follow the gingival-cervical portion of the tooth where you intend to put the C-clasp. So for this clasp, we will be using simply a bird beak plier. So we start by taking the shape of the tooth. So we mark again where we will be putting the loop. After the clasp is properly hogged onto the tooth, we can mark where the contact area will stop to make the loop go into the gingival area. So next is we have again to properly shape the wire onto the shape of the palette. Cut the excess wire. So after you have properly shaped the retentive area of the clasp properly, we then put a retentive loop for the acrylic base. So here is your C-clasp. The next clasp that we will be discussing is the Adams clasp. This is also known as the universal clasp or the modified arrowhead clasp or Liverpool clasp. This clasp makes use of initial and distal undercuts and uses an 028 stainless steel. The Adams clasp is predominantly used as a retentive component in orthodontics, but it is also used to retain appliances such as partial dentures, obturators, and mandibular advancement appliances for patients with obstructive sleep apnea.
An Adams clasp has three parts, namely bridge, the arrowhead, and the retentive arm. The bridge should be straight and midway between the occlusal surface and gingival margin. It should also span 2/3 of the mesiodistal width of the first molar. It can also be a 2 mm away from the tooth surface and parallel to it, and when viewed from the side, the bridge should have at least 45-degree angle to the tooth surface.
The second part of an Adams clasp is the arrowhead. This should be parallel to each other and should sit on the mesial and distal undercuts that are approximately half the height of the clinical crown.
The third part is the retentive arm, which is continuous to the lingual or palatal surface that get embedded into the acrylic.
To start making the Adams clasp, we first have to prepare our cast by scoring the gingival margins of the tooth. After so, we can get the width of the bridge by marking the tooth. So to get the 2/3 width of the bridge, we can start by marking the cusp of the tooth down vertically. And the bridge has to be at the midway of the occlusal surface as well as the gingival margin. So for this, we can also mark this for a guide. After so, we can already get our 028 stainless steel wire. So now we have a guide. So we can start by marking the width of the tooth. With our marking, we can start making a triangle. So we check it again on our cast. So after we get the correct width, we can now start by making our arrowheads for the retentive part of the Adams clasp. So for this, we can again mark by having our marks on the midway of the tooth. We can now know where we can start making our loops. So with our marks in place, we can now start making our loops. So we put the loops 90 degrees from our rectangle. So here. And on the other side. after you create your loops, now we make a 90-degree bend onto our wire here near the level of your bridge. So in this part, so there you can see that they are approximately in the same level. So we do the same to the other side. So here it is. After start putting this onto our cast to check the level. So by checking, you have to see that when we press the loop onto the interdental embouchure, we have to see that the 45-degree angle between the buccal surface of the tooth and the bridge is there, as well as the distance of the bridge, which should be around 1 to 2 millimeters away from the tooth. And then after you have seen that it has fit, you can now start bending onto the embouchure area of the tooth. When you check the gingival portion of the loop or the Adam's clasp, you have to see that there is a diverging shape of the loop from the bridge of the clasp. Here we can now start bending onto the area of the embouchure of the tooth. So I will be marking where the contact point will be ending, so that is where I will be bending the loop going to the gingival portion.
Go.
So now I have a stop so that I know how my Adam's clasp would be fitting properly, so then I can start making this part of the clasp. So now that the clasp is properly fitted onto the tooth, we can now start bending the retentive portion of the clasp onto the acrylic portion. So by doing so, we have to follow the shape of the palate, and it should not touch the palate because it will be shown onto the lingual area of the acrylic. So now we see that there is some space between the wire and the palate. We can now create loops for the retention. To create loops, just use your bird beak. So here's the first loop, and now we make the second loop. So cut the excess wire. Then, here is our Adam's clasp.
We now proceed at ball end clasp. This clasp has a ball at the end which engages the proximal undercut between two adjacent teeth or interdental area.
Preformed wires having a ball at the end are used for making this clasp. The ball can also be made using a silver solder. This clasp is used whenever additional retention is required. For a ball clasp, we can use a prefabricated wire with a ball end, or you can fabricate your own using a silver solder, such as this. So, for such fabrication, you will have to shape it properly until it fits into the interdental undercut of the tooth, like so. Ball clasp using a silver solder. So for today, we will be using the 3-prong plier to fabricate this clasp. So again, we have to score the cast. So you have to score the interdental gingiva of the tooth where the ball clasp will be ending. So after we have done that, so we will be inserting the ball into this area of the teeth. We take our ball, and then an important note for this is that it has to have an arc. So upon fitting, we have to slightly distance the wire away from the tooth so that there would be an arc. So after the slight distancing of the tooth and the wire, we again mark where we will be putting the loop. So after our mark, using a 3-prong plier, we bend the wire completely, and then check again if it fits onto the cast. So here, it fits onto the cast, so we will continue bending onto the embouchure area of the teeth. So again, I will be marking where the contact point ends as a guide to where I will be bending the next loop. can cut the wire if it interferes onto your fitting of the clasp. So our next part to make is again the retentive area of the clasp in the palate area. So after you have already shaped the wire properly onto the palate area, we can now proceed to making a retentive loop for the acrylic base. So again, using a bird beak, just make a loop. And then place it back. So here is your ball clasp. The last clasp that we will be discussing is the triangular clasp. This has a small triangular shape that engages the proximal undercut of two adjacent teeth. It provides excellent retention.
And it doesn't cause irritation of the gingiva. It is used when additional retention is required.
To start making a triangular clasp, first you have to again score the interdental area of where you intend to fit the clasp. So in this case, I will be fitting it here between the premolar and the molar, scoring it again. After which we proceed to our wire. So to prepare making a triangular wire, we first have to shape a triangle out of A028 stainless steel wire. So just with the use of your bird beak plier, we can make a triangle.
Go.
Make So, after you have made a triangle with a wire, you have to check the base of the triangle here if this would fit with between the interdental undercut of the tooth. So in this case, it already fits. So we will proceed to continue making the clasp. So when we make the clasp, we have to make a 45-degree bend from the base of your triangle going to the mission area. So we bend this going off at 45-degree angle. So here, again, we have to fit this again onto the cast, then check. So at this point, we have to put our bend onto the middle of the two teeth. Good. So here, we have bended the wire so that it conforms onto the middle of the two teeth. And now, we again take our marker. We can mark where we will be incorporating our loop towards the occlusal area. Mark again. Cut the excess wire. Fit onto the cast again. So after which, the next part that we will be fixing is the retentive area of the loop. So here we start again by shaping the wire onto the shape of the palette and then making a retentive loop for the acrylic base. So after shaping this properly, we then now put a retentive loop for the acrylic base. And here we have our triangular clasp.
That is the end of our video. Thank you for watching.
We hope that we have been informative and helped you on your dental cases. Thank you.